Hi everyone. Very good afternoon, and this is Dr. Sibashish here from ResMed, and I would like to thank Ekincare for having us here in this particular, short lecture on sleep and immunity. And I think we'll try to do justice on and try to inform you how we can improve our sleep and which overall reflects on the well-being. So, maybe in the next 20 minutes, I'll try to emphasize upon the rules of healthy sleep, or rather, something known as sleep hygiene. But at the same time, I would ask you to, ask questions in between. I can stop in between. We can make it more interactive, and at the same time, if you see in the live comment section, you will find a link which actually is a link to the sleep quiz, which tells you how good you are sleeping, or do you have any risk of something like what we call as obstructive sleep apnea. So first thing about ResMed, I work as a consultant with ResMed, and ResMed is a sleep device company. In fact, the innovator of sleep devices, and has been around for uh, you know 30 years, particularly in over 120 countries with 7,500 employees. So it's one of the top-notch companies on in terms of sleep medicine, and it's really enriching to be part of this particular organization, which has perhaps the world's largest connected care sleep devices. So, to take things on a lighter note, right now we are currently working from home, and there is also a kind of lockdown going on, which is, of course, now it's much more relaxed. But then, even when we are working today, we are having high reliance on technology. We kind of do all our meetings through some tech services like Google Meet or Zoom or WebEx, and the interpersonal relationship has kind of gone down or has been based on various technologies. So there's a lot of stress which is kind of building up, and added to this, I hear very often that uh, you know many patients are kind of losing sleep because they're working from home. They are going to sleep late at night, maybe doing some amount of Netflix or something else. This all builds up in the form of kind of stress. But if you ask me, whenever we talk of stress, and we always say that okay, we should lead a very healthy lifestyle. And moment we talk around healthy lifestyle, we always try to touch upon a couple of things like, okay, we need to exercise a bit, we have to take healthy food, you know but seldom, we kind of speak around something known as something sleep. How can we always think that how can sleep be a very important component of of a well-being or a good health. So we'll try to understand why sleep is so important. And in fact, if you see, almost one third of our life we spend sleeping. So if we are doing something for like one third of our life, it has to be really really important in terms of health. So I typically call it as a triad. That okay, if you want to get a good or a healthy lifestyle, if you want to get a good immunity, if you want to reduce your stress level, exercise, take the right food at the right time, and of course, you have to sleep well. So this is basically the triad of healthy, good or healthy living. So let's understand sleep. So as I said, we spend one third of our life, uh, but then we are not so bothered because it happens every day. Every night we go to sleep. Every night we go to sleep. There is loss of consciousness. Uh, we our physical activities goes down when we sleep. In fact, most of our organ systems kind of go into a very resting phase when we kind of sleep. But even if I say that most of the organs goes into a resting phase, it is not so passive. For example, when we are sleeping, our immunity is really active around that time. We release different type of hormones, which actually regulates our immunity. Our brain goes into a mode where it is consolidating our memories. It's preparing us for the next day. Okay, our heart rate goes down, around 10 to 20%. So our heart gets rest. Our kidneys tends to slow down. Our respiratory rate or breathing goes down. Slow. So although we are seeing that most of the organ systems are kind of slowing down, but then it's happening for a purpose. It wants to give the body some rest, but at the same time, our immune system is releasing certain hormones which are overhauling, right? So this is something which is very fascinating about sleep. But we are always concerned. The first thing which I hear from patients is that how much should I sleep? And this is also a very common question which I get from mothers who have teenagers at their home who wants to sleep late at night, get up late in the morning and so on. So if you look typically, for young kids, typically this is something around 1 to 3 years of age. They sleep around 10 to 14 hours a day, which is quite normal for them. For teenagers, I would say we they need sleep somewhere around 7 to uh, at least 9 to 10 hours. And for people like us who are over 18 years of age, till around 50, 55 years of age, we need around 7 to 9 hours of sleep, right? So that is the quantum of sleep. But then it's very interesting that as we age, our requirement of sleep also goes down. So you must have senior citizens in your home, and they might have said that I don't get much of sleep now these days. And this is particularly because they are aging, and the overall requirement of sleep has also gone down, right? So this is with regard to the quantum of sleep which you have. So maybe I can take a quick break here and see if there is any question from the attendees. Any questions, any queries which you have, or which you would like to discuss at this point in time? You can always type in your comments or questions in the live comment section. Okay, so I'm not getting any live comments as of now, so let's go ahead. And like I was saying, that what's the quantum of sleep? But then if I can tell you, it's not always around the quantity of sleep. It's also around the kind of quality of sleep. And it also depends how good are you sleeping. So if you look at regular sleep pattern, suppose if you're sleeping for around 7 hours or to 8 hours in a night, possibly you will have a certain phase of sleep which we call as at least 4 to 5 times in a night, and that is the period when you have dreams, right? But if you're not getting a good quality of sleep, your entire what we call as the sleep architecture goes haywire. You don't get dreams. You wake up very often within in a single night, and then when you wake up in the morning, you feel very groggy and kind of irritable. So so that is what happens when you don't get the quality of sleep. And if you don't get good quality of sleep, it will impact your immune system. So there has been many studies which say that if you are sleeping well, both in terms of quality and quantity, you would have better immune system, which actually can produce good amount of certain substances which we call as cytokines. And the cytokines actually help in fighting different bacteria. So yes, so I think there are a couple of questions which are coming in. So someone is asking that is there is any time cycle for sleep? So good question. And if I can answer this, everyone has a time cycle, right? Someone might go to sleep around 10 o'clock and get up at around 5 o'clock. Someone might sleep at around 11 and get up at 6 or 7. The idea is to have at least, if you're 18 years of age, at least have like 7 hours of sleep. But then, if you are having a definite time, suppose you go to sleep around 10 or 10:30 every night, please stick to that timing. That is what matters. So that's your time cycle. Okay. Uh, so you can go ahead. There could be a variation of around 20 minutes here and there, but that should be okay. There is someone who says, what about an expecting woman or a pregnant woman? How much she should sleep? Okay, and it's a very good question. It totally depends on you. If you want to get some rest, please do. So typically what we see is that pregnant women require more amount of sleep. So although even if in the night she has slept for around 7 to 8 hours, it is always good to take some amount of rest or at least a nap in the afternoon hours. So you need a bit more of sleep because your metabolism is on the higher side. So if you are sleeping, if a pregnant woman is sleeping, she is also giving rest to the to the fetus or the child which is inside her. So yes, it could be a bit more, 1 to 2 hours more, and that's okay. Even if as a pregnant woman, they tend to feel more sleepy at times, and that's okay. Please take rest. Please go if you feel sleepy. Go ahead and sleep. Okay. So, this is these are the two questions which I could take. There are a few questions. Let me just see through. There's someone who is saying that I find it tough to sleep for more than 4 hours at a stretch. Okay, so it really depends. I don't know what the underlying factors are. You should also look at factors something like what kind of work are you doing? Are you kind of suffering from any other stress? So ideally, it shouldn't be 4 hours at a stretch. It should be more than that in the night. Okay. But I would like also to point out that sleep is a very personal phenomena. So although there could be guidelines which say that okay, you need 7 hours of sleep, but then in reality, I've encountered many people who are kind of good with 5 hours of sleep, 6 hours of sleep, and they feel perfectly well, fresh, very motivated when they wake up next day to go to work. Okay, so please check on what is your stress level. Is there is any anxiety? Also check on whether you are sleeping during the daytime. So if you're sleeping for more than 30 minutes during the daytime, then probably you will have less sleep during nighttime also. That is also one phenomenon. Okay, so I think as we go ahead, we'll take few more questions. So let's move ahead with our discussion on sleep quality. So just imagine you have gone to a friend's wedding and you have slept just for 4 hours at night, or maybe 5 hours, and that too it was very interrupted. Okay, someone is waking you up, there is kind of commotion in the other room, someone is laughing, which typically happens in a marriage setting. So I always quote this example because this is a perfect setting for sleep deprivation. And when this person wakes up in the morning, he straight away again goes into that celebration mode, and we know how it feels. We feel groggy, we feel irritated, we want more sleep. All those things takes place. But if I can point out in real life scenario, we all are working. In Indians, we are sleeping somewhere close around 6 hours, not more than that, whereas the recommendation is around 7 hours. And if you look at sleep deprivation will affect both your body and your mind. So bodily functions, your heart rate would be erratic or irregular. You can feel palpitations if you have not slept well. Your you tend to become more hypertensive if you have not slept well. Your aging would accelerate. There would be loss of libido or sexual drive. So all these things happen from a bodily phenomena, and at the same time, your immunity would also be affected if you are not sleeping well. Added to that, let's look at the mind component, which from where the entire stress phenomena develops. The first thing which happens is the person wakes up very irritable, you know, doesn't want to talk to anybody, keeps close to himself, is not able to give adequate inputs to any discussion. Suppose you are in a workplace, you would be giving lesser inputs if you have not slept well. Your memory and learning would go down. And of course, the attention span, which we need more when we are working from home, that also goes down. So in totality, sleep deprivation is there. It impacts both body and mind. Okay. And typically it so happens, it has been found even in Indian workplaces, that someone is sleep deprived, has woken up many times in the night, and has not done well in his work. Also, the productivity has gone down, innovation level has gone down. uh, you know People have been found sleeping at jobs and sleeping in meetings and have got fired. So there are multiple drawbacks which are there, and again, all these things, cycles back to more stress. So there is someone who is asking that how is sleep related to kidney and liver? Although the question might sound very laymanish, but it's a good question. So when we are sleeping, our urine production actually goes down, and that's a very physiological response. So that we can get that good amount of sleep. We don't have to wake up in the night and go to the washroom, right? So that is with relation to the kidneys. With livers, it is impacted in a sense that liver also controls certain bit of immunity. So in that way, the liver will also get impacted. So these are all physiological things which happen. Okay. So what happens to the heart rate? So suppose your heart rate is around 80 to 100, and this is something which I always emphasize, because very often this is one of the cause of a certain disease known as the obstructive sleep apnea. So while you're sleeping, if in resting phase, suppose your heart rate is around 84, while you are working during the day, during sleep it drops down a bit. It drops down to somewhere around in the early 70s, and that's because the heart also wants to get some rest, and it goes into a resting phenomenon. But if you're sleep deprived and if you're waking up, several times during the night, this heart rate would tend to increase every time you're waking up. So your heart is not going to get that rest. And this kind of people are more prone. Suppose if someone has an existing cardiac disease, they are more prone to develop serious complications from them. That and these are all based on different scientific studies and literatures which has studied them extensively. So that's why I was saying, interrupt with sleep during the night is not good for heart, and particularly for patients who are cardiac patients or are having some kind of high blood pressure or hypertension. Okay, so there was one question regarding shift work, and I'm going to touch it because this is something which I feel very strongly about, because in our country there are many people who are in IT sector and want to are actually working in shift, particularly in night shift. So that is also one area where we see many good amount of sleep deprivation. So what I would do is, I try to share few I would say hygiene measures which I call, or sleep tips for night shift workers. So number one is that while you are kind of sleeping, uh, put on bright while you are working, put on bright lights. So the bright lights is basically to kind of sensitize your brain that okay, you are working in a bright light and you shouldn't go to sleep. But when you are not working, or you are trying to sleep during the day, try to keep your bedroom free from all kind of distractions of light or sound, because it is during the day when most of the people are working on the other side. So your bedroom should be a very quiet place, dimly lit, which actually puts you to sleep. The other thing, while we are working at night, there is always a tendency to take good amount of caffeine or coffee or tea. So suppose if you're working from like 8 to 4 o'clock in the morning, ideally you shouldn't take any coffee after 2 o'clock at night. So because coffee at least takes around somewhere around 6 hours to move out of the body. So reduction on coffee or tea is very important. The other thing is, which I tell, but I understand it could be quite tricky, is that try to maintain that regular shift. Try, if you're working at night, try to work at night. Don't try to shift your shift, like, okay, if you're working one day at night, one day in morning, one day in afternoon. So that shouldn't happen. Then it becomes really troublesome for your body to actually adopt to this cycle. So if you're working at night or in the afternoon, try to maintain that shift. Uh, and the other thing which I always try to point out is that stay away from gadgets, something like cell phones when we are planning to sleep. So these are the few tips which probably which you would want to kind of try out if you are a night shift worker, right? So yes, let me go ahead and share something very important. So there are different risk factors for hampering sleep. Alcohol, sleeping pills, shift working, just as we discussed, jet lag, technology, bedroom, the temperature in your bedroom, and of course coffee. So uh, so if I can talk around the quality of sleep, which are the most important influencers, number one is alcohol, and second comes the technology piece nowadays. So why alcohol? Typically, when we see and someone is asking that what is the major factor that influences quality of sleep. So whenever someone takes alcohol, we feel that okay, it helps us to go into sleep, in a very quick manner. So what we call in medical terms as sleep latency is reduced. But when you are sleeping, your sleep architecture is not that good. So you might have very well realized that if you have taken like 2 or 3 pegs of drink, when you wake up in the morning, we always have a headache, or we have that ability, something like that, which we typically call as hangover. So all this is because we haven't slept in the night in a good manner. So that is really taking down the quality of sleep. Uh, we also see similar phenomena when we take sleeping pills. There are many patients who are insomniacs, and we have to prescribe so-called sleeping pills for them to put into sleep. But then the idea is to take them to get them some amount of sleep where they are not getting sleep at all, and then gradually taper them off from the sleeping pills. The third point, which I always mention, is technology. Technology has basically reduced our sleeping time, also has shifted our sleeping time late in the night. So if someone was sleeping at 10 o'clock at night, nowadays he's sleeping at 11 or 12, because we are watching our mobiles, we are watching YouTube or Facebook video or something else, right? So technology is again the third thing which is very evident has hampered sleep, right? Okay, so there are a couple of questions probably which I've already answered during the course of the discussion. So there is another thing which is not very uh, I would say day-to-day phenomena. It's not very medicalish, but it is something very cultural. So there are many people among us who snore, and if I can just uh, you know ask for a quick raise of hands or voting that okay, how many of you how many of you snore, or how many of you have seen people snoring, and do you consider snoring to be quite normal? So can I have a quick show of hands, or like a yes, I've seen people snoring, and or I snore, something like that. You can put up your comments on the live comments. Okay, I think people are a bit shy, but I think if I can tell you, uh, snoring as a whole, everyone feels that okay, if someone is snoring, uh, or karate marna as we call in Hindi, is a very good sign of sleep. Typically there are even proverbial words like okay that uh, karate मार के सो रहा है और घोड़े बेच के सो रहा है, something like that. Okay, but and it is very cultural. We Indians always say that हाँ कितना अच्छा सो रहा है, घोड़े बेच के सो रहा है, देखो कितने मजे में सो रहा है, wish I could sleep like this. But in reality, snoring is actually a symptom of disturbed sleep. Okay, so again, quality of sleep is really, really hampered if you are snoring. So, and snoring is also a sign of something called sleep apnea. So, uh, it might not be a definitive sign, but it could be a maybe sign of sleep apnea. This is one of the symptoms of something which we call as uh, sleep apnea. So, and in many forums we try to sensitize people around sleep apnea and so-called snoring, because uh, we always think it's quite normal, and what harm could it do to us if we are snoring. But if we look at sleep apnea, this is something, if I can declutter this sleep, it is something, uh, it's an apnea which is happening while you are sleeping. Apnea means stoppage of breath, which basically means that if when a person is snoring, uh, the upper airways or the upper part of the nose and the neck has collapsed onto itself, and air is not actually getting inside the lungs. So imagine a situation where you are sleeping, and because of the collapse of upper airways, air is not getting into your lungs. So what will happen? Oxygen levels in your body would go down, and moment the oxygen levels go down in your body, the brain gets activated and gives you a very small jolt to wake you up. So this, in typical terms, we call as micro arousals, very small awakenings. And you wake, you again breathe, and then go off to sleep. So now this phenomena happens, not once or twice in a night. It might happen, 70 to 100 times in a night. Okay, and when this phenomenon happens to that extent, just imagine, 70 to 100 times the person has woken up during the entire course of night. So he is not getting that good quality of sleep. So that's why I was saying that if someone is snoring, it's not a very good sign of health. And what I can do is I can tell you a few symptoms, you know, which is related to snoring. So typically, what we see is in men or males, we see that they come to us with, okay, I'm feeling sleepy during the day, or I'm having some attention problem during the day, or the wife has brought the husband uh, to the clinic saying that okay, my husband snores, and I have to push him sometimes, and I have seen my husband, stopping his breath while he was sleeping. And in many cases we find that, around 50-60% cases we find that okay, this person has an existing diabetes, or some kind of hypertension and so on. So typically this is what the cases with males are. For women it is more insidious, because if you ask any female, okay, do you snore, they don't snore. They would say no, no, I don't snore. And in reality also they snore on the lesser side. So they come with symptoms like, when they get up, they are having some amount of morning headache, or they are feeling fatigued and tired during the day. They are irritable during the day. Okay. So these are the few symptoms which we always see for sleep apnea when someone is having obstructive sleep apnea. But I think the good part is, you can always get yourself at least screened, and I think you can see a link out there where you can take your sleep quiz. And if I can share my screen, let me just share my screen, and Yeah, so if you can see my screen, this is also a QR code which is there. You can scan this QR code, or you can type in the link which is below. This link is also there in the live comment section to actually check whether you are having any risk of sleep apnea or how your sleep is right now. And typically what happens is that if you have risk, it would show you that you know in what category you are, whether you are in mild, you are in moderate, or in severe category. And if you are in moderate to severe, then you have a higher risk of sleep apnea. So this is one of the simplest of screening tools which we have. Okay, so what we can do is while we are you know while we can wait out for a couple of minutes for you to fill in this quiz, and in meanwhile what I can do, I can answer a few questions which are there. Okay, so let me couple of questions. The link is still there. You can answer it. So there's someone saying that I'm sleeping for more than 9 hours, but next morning I feel unrest, my eyes blinking, and some irritation. So Anil, I think this is quite common. We see that okay, even after the person has slept for considerable duration of time, if there is some amount of irritability or unrest, as you are saying, or maybe it could be vague symptoms like feeling tired. We always say that okay, please go for a sleep quiz at least, like what is there, because these are signs of sleep apnea. And at the same time, you can also look at your family history. If someone in your family has habit of snoring, has diabetes or hypertension, you should get screened for this. So let me take up few other questions. There's someone saying that I often wake up at night coughing. Why is that? Is that something like sleep apnea? Could be. I cannot tell for definite, but if you're waking up coughing, somewhere your airways are collapsing. So in this kind of scenario, we say that okay, please go for uh, a sleep test, which is over a night. Actually, we do it over a night, and then ascertain that what was happening. That typically measures your respiratory rate, what is the oxygen saturation, and what your sleep pattern looks like while you were sleeping. So yes, could be sleep apnea, but then you have to undergo some amount of diagnostic test. There's another comment from someone saying that I do exercise in the morning and that makes me sleepy during the day. How do I bring a balance here? So totally appreciate this. This is a very common thing which we see. And typically what we always suggest is that many of us who are working, they reach office quite late, around 8 o'clock and 9 o'clock, and then they tend to uh, do some exercise in the late evening hours. So first of all, don't do that late evening hour exercise. Ideal time of doing exercise is typically around 5 to 7 ish, around that time. So that's the best time. But then for many reasons, because of our work life and so on, it is not possible. uh, so yes, this is one other thing which you can do is, if you're feeling sleepy during the day after exercise, try to expose yourself towards bright light or sunlight during the daytime. That would actually help you for that. There are medications, but then these are the small lifestyle modifications which you can bring in, to combat any daytime sleepiness if it is directly related to exercise. Okay, let me. So there's someone saying that is sleep apnea a forewarning to heart disease? Is it necessary to treat snoring? I would say yes. If you are in the moderate or severe category, and if your sleep test shows something called AHI more than 15, it is necessary to get yourself a therapy. There are different therapies. So to treat snoring, and it's always a forewarning for many diseases, heart disease, and in fact diabetes. And in fact, in certain cases, right now we see cancer also getting related to sleep apnea and snoring. So there is certain amount of association. So we always encourage that, okay, if you have a family history, if you yourself have a history of diabetes and you are snoring, please get yourself tested and take interventions related to that. A few other questions. Is it beneficial to analyze sleep with smartwatch or fitness band? How accurate these things are in terms of sleep tracking? I think a very interesting question. And uh, what has happened, if you look at the higher end smartwatches, typically iPhone or Garmin or Fitbit, they have an algorithm built into it saying that yes, they can tell you how good your sleep is, and yes, it is effective. They can tell you how well it is. There are certain ways they measure. That's how the algorithm is built in. uh, but then that's an indicator, that's more of a screening to tell you that whether you are sleeping well or not. But then I would always suggest, if there is something which is coming in your smartwatch where it is saying that your REM sleep is going down or you have snored during the night, uh, undergo sleep quiz, because this sleep quiz is a scientifically validated. So you have to come to a clinician to get it further ascertained. But all said and done, those smartwatches and fitness band are good indicator to how you are sleeping. So there is someone who has written, why is sleep important? What are the benefits of sleeping well? Uh, for that matter, we know that sleep is important, but what we don't know is why we actually sleep and why do other animals sleep. So there has been a lot of theories, right from uh, uh, you know conserving energies to several others. But I think the most important theories which are right now is, sleep is important because our body gets a lot of rest. Second thing, we produce hormones which impact our growth, our immunity. Okay, so these are the two important aspects which are right now being studied, and it is really intriguing that even after 60, 70 years of research, we don't know why we sleep. Okay, or what is the main reason for sleep, or for sure I can tell you the benefits of sleep, like what we were discussing, right from giving rest to the heart, increase on our productivity, getting our memory consolidated, and so on and so forth. But why do we sleep? We don't know that really. So yes, there is someone who says that I take antidepressants, and definitely antidepressants have some amount of disturbances in sleep. But if someone is taking antidepressants, I think that has been given for anxiety or other depression related phenomena, and that's okay. That's okay. If you're having some kind of vivid dream while you are sleeping, that's probably a side effect, and that's okay if you. And I would say that's completely okay if the antidepressant is helping you overcome the primary cause of depression, right? Okay, so I think these are the few questions, and if I can come to the last part of my lecture. So I'd like to point out few sleep hygiene, and before that, I mean, if you have taken this quiz, you would receive in your email at what kind of risk factors you are in, whether you are in moderate or severe category. And if you are in moderate to severe category, the next step is always to undergo something which we call as the home sleep test, which is performed in at the comfort of your home for a single night, and actually it shows you what how much of sleep deprivation or sleep apnea is there, which is present over a single night. Okay, and then of course you have to visit a sleep specialist or go to a sleep clinic to get that treated. So that is something which I'm not bringing into discussion in this particular lecture. But then coming to the last part, few tips on sleep hygiene, particularly during these times when most of us are working from home. How do we de-stress ourselves? So number one, if you are gouging on technology, please reduce that. Most of us have now around 20 to 30% higher screen time because all of us are working from home, right? So that is one barrier. And very often, if you are binging on Netflix or YouTube at night, please refrain from that. Don't take your mobile phones to bed. The second thing, use your bed only for sleeping. Don't use it for chatting, reading book or something like that, because then your body gets in tune that okay, this is bed, and I just sleep here. I don't do anything else in my bed, right? The other piece, and quite interesting, don't drink too much of water if you are planning to sleep. Don't drink alcohol or don't drink caffeine at least 2 to 3 hours before your scheduled time of sleep. That is going to disturb your sleep. Okay. If you are working from home, try to simulate how you are working in your office. So like, okay, take up a table and a desk, start working from 9:30 and then till maybe 5:30 or 6. So that's how the schedule should be. Don't vary your schedule. Don't try to take a nap or a big nap, like more than 30-minute nap in the afternoon, and definitely not after 3 o'clock in the afternoon. That is going to hamper your sleep and the night hours. uh, the other piece is definitely which I point out, uh, is something like your bedroom. Your bedroom should be a calm and quiet place. And if you are getting difficulty while you are in your bed, and you are having difficulty while sleeping, uh, please move out of your bed, go to any desk or chair, or try reading a book. That really helps if you are not getting sleep in your bed. And this is something which I always try to tell people who are also insomniacs. And the other thing is, please get some exercise. Get some natural sunlight. Or you can also take a very a warm bath, or do some kind of meditative exercises when you are if you're not getting adequate sleep. So those also kind of helps. Those things are really helpful and has been proven to take care of in good sleep. So okay, so there is someone who is saying that how can I remove the obstruction which is causing snoring at the time of sleep? So unfortunately, typically, what happens that as we age, our neck muscles get more and more relaxed or lax. So physiologically, through exercise or anything yoga practice, it becomes very difficult to control that. So there are devices known as positive airway pressure devices or PAP devices, and these are devices which helps. Actually, there is something which you put in the form of a mask while you are sleeping, and then that actually opens up the airways which are collapsing. Okay. So that is one of the ways of treating sleep apnea. But at the same time, not only this device, we also have to reduce our weight if there is any weight. If we are overweight, uh, you also have to take care of your other habits like binging on alcohol. Okay, so that has to come down if someone is a sleep apneic patient. So these are also the lifestyle modifications which we suggest in addition to CPAP device or APAP device while when a person is suffering from sleep apnea. If I can take the last one question. There's someone who says that I remember dreams in detail. Does it mean that I don't sleep well? Maybe and may not. So we don't dream once in a just once in one night. We may have multiple dreams, like 3 or 4 dreams in our entire sleep duration of 6 to 8 hours. Typically, we tend to remember the dream which in the last phase of or in the morning phase. And very often, I've seen people who are more, prone to, I would say, sleep apnea. They tend to remember who have alarm clocks. They tend to remember more dreams because you are straight away jumping from your REM sleep to, awake state. So there you might remember, but that doesn't mean you have obstructive sleep apnea. Remembering dreams has no relationship with direct relationship with obstructive sleep apnea. Okay. Okay. So let me take just one last question and then we close this session. So there is someone who says that I am doing night shift, so I sleep after 5 a.m. but I wake after short duration of time. Why do we wake after short duration of time? So again, please follow the sleep hygiene. Whether you are taking caffeine during at night, what amount of caffeine are you taking? Are you if you are working from home, I would be pretty sure that you'll be concerned what your other family members you are doing or so on. So remove all those thoughts. Try to get into the sleep mode. Make your bedroom dim lit. Close all the curtains and also reduce any noise which you have. So with that, I think you will have a better sleep. There are medications, but if you follow this sleep hygiene, they would help you in the long run. Okay. So great. I think there was quite a bit of lively discussion which we had, and let me end this session by thanking Ekin Care, uh, who made this event possible, and of course wishing you all a good sleep and wishing that you stay healthy and safe during this troubled times. So thank you so much and take care.